health authorities in the Bono East region are worried about the increase in number of maternal mortalities in the area. At the 2024 media review meeting in Kintampo, the Regional Health Directorate revealed a maternal task force has been instituted to curb the trend. Regional correspondent Anna Sabet has more.
2024 half-year performance review meeting of the Bono East Regional Health Directorate was held under the theme Building Resilient Structures for Universal Health Coverage and Quality, the Role of Network of Practice and Partners. Regional Director of Health Services Dr. Fred Admakobwatin bemoaned the increase in the number of maternal mortalities, with the region recording 73 maternal deaths between January and June this year.
If you look at maternal mortality, for 2020, the number of women who died giving birth per 100,000 live birth was 95 for 2020. 2021, it was 80. 2022, it was 85. 2023, for the year in review, it was 107. But 2024, 73, very close to the Sustainable Development Goal.
The region also recorded an institutional maternal mortality rate of 6 as at mid-year, with a target of 8 per 1,000 live births.
Then if you also want to look at the institutional neonatal mortality rate, if you look, the target is supposed to be 8 per 1,000 live births. So you look at 2020, it was 6, 2021, 8, 2022, 7.6, 2023, 8.1, 2024, it was 6. And these are what we call quality indicators. These are things that a lot goes into the processes and steps to make sure that you get a better outcome.
Dr. Mrs. Alberta Brechum Nyakung is the Director for Policy, Planning, Monitoring and Evaluation Division at the Ghana Health Services Headquarters. She reiterated the relevance of the network of practice to improving healthcare, particularly in rural areas, as resources are mobilized to help improve quality healthcare.
In the urban areas, there are many facilities in a particular area. So if people want to seek healthcare, it is not difficult. And there are bigger hospitals also in the urban areas. But in rural areas like this is where we even want to form those partnerships, so that even if we are few, we are stronger together and we are more empowered to reach the community.
Dr. Fred Admakobwatin was, however, quick to note that as part of efforts aimed at reducing maternal deaths, the region has established a maternal task force to help educate pregnant women on what to do to ensure safe delivery.
We have formed what we call maternal task force, led by obstetrician and gynecologists. And their duty is to make sure that all these recommendations that spring up from the audits are implemented across.
Reporting for Joy News, Anas Sabit, Kintampo.
Well, let's speak to the Bono East Regional Director of Health Services, Dr. Fred Admakobwatin. Thank you for your time here on Newsdesk. First of all, educate us. What is accounting for the rise in maternal mortality in the region?
Good morning to my listeners. The name is Admakobwatin.
Okay.
No, Admakobwatin. So it's Fred Admakobwatin.
Okay, noted.
Okay,
please make your point.
Yes. So there are a number of causes but I have to make this submission that despite all these figures that Bono East is recording, we are still within the range as stipulated by what Ghana wants to achieve. So you look at the standard of maternal mortality that we are looking for a region to achieve, to be able to make sure that we are going closer to the SDG 3, that says that by 2030, every country should have less than 70 maternal deaths per 100,000 live births. So if you even look at what we are discussing, I'll just give you some figures. You see that we are just within the range and getting closer. But we believe that, look, we don't even have to allow for even one maternal death because of a lot of the repercussions, social, economic, and all those. So I'll just give you some figures and put the discussion in perspective. So if you look at 2020, half year, maternal mortality per 100,000 live birth was 95. And then you look at 2021, it was 8. Then 2022, it was 85. But 2023, we were almost 100. Though we were within the range, it was cause for alarm for us. What was happening for us to get out of range, despite what we were doing? So we had to put in mechanisms in, and I'll come to what was causing for that. And then 2024, as we are discussing half year, we have been able to reduce it to 73, almost closer to the SDG. But come to the point, what was causing that? Even if you look at all the indicators that we look at to stem the rising figures of maternal mortality, I'll give you some figures. So 2020, the skilled delivery, the women who are going to deliver, the WHO criteria is saying that they should be delivered by skilled midwives. So if you look at even 2020, 66% of women who were delivered by skilled personnel. If you look at 2021, 68% of them were delivered by skilled personnel. 2020, 68% of them were delivered by skilled personnel. Surprisingly, 2023, where we had an alarming rise in the maternal mortality ratio, 68% of them were even delivered by skilled personnel, which then indicated that why should they die? But even if you look at 2024, you see that the skilled attendance is to 62%. They are seeing some trend in that. And not only maternal mortality ratio, we have noticed that all the other quality indicators, i.e., you are looking at neonatal mortality rate, you are looking at stillbirth rate, for this year, they have reduced drastically. And that comes to firm what we believe. 60% of all maternal deaths, 60% of all maternal deaths occur during delivery, labor. So it means that if attention is not paid during this area, the woman can attend ANC several times, 8 times, 9 times. But if we don't really pay attention to these quality issues at the point of labor and after labor, we lose them. And that has been our focus for this year. So if you ask me, what are we doing? The task force now, our focus has been, we look at maternal mortality every quarter. We don't even wait for the 6 months. And when we see any deaths occurring, it's the duty of maternal force to look at what actually caused this death during labor and the follow-up. What we saw previously was that all the recommendations that we made, especially during the audits, that we were supposed to implement to avoid all these, were not being followed. So the task force duty is really to look at, okay, so what was the cause of this death? Did we lack any logistics? Was it monitoring? Was it supervision? Was it referral? And then we follow to that. So you see that though the skilled delivery has reduced to 62% as compared to 68% in the last year, the quality has improved. And this is affirming the fact that, look, it's not only coverages, it's not only increasing coverages, the number of ANC that you are, no, it's the content of the coverage, the asset. When people meet the interface of the staff and the patient, it's not only measuring the blood pressure. Are you measuring the blood pressure well? And then are you using the blood pressure to make sure you put in intervention that should avoid any pregnancy in hypertension, which is difficult to manage? And that is what we are doing as Bono East, to nip all this in the bud. So if you ask me, the game changer for this particular year has been really looking and then talking about if there is no quality, there is no access. Mind you, the universal health coverage has been saying that, look, everybody should have access, and we can discuss access in terms of geography, money, scale, but the caveat is without quality, there is no access. So the person can come 10 times, but the service that you are giving to the woman, is it really meeting standards? Are you really looking at? And I'll say that will be a game changer for us. we are aiming at the end of the year, for the first time in Bono East, we want to hit less than 70 maternal deaths per 100,000. And not only that, we will begin to go and then look at counts.
Unfortunately, we run out of time,
purpose.
Dr. Fredge. I'm sure in subsequent bulletins we'll expand on this conversation as we look at the measures you're putting in place to curb this tide.